morning. My name is Cindy. I'm going to be your nurse practitioner today. Can you tell me your name?
Debbie.
Okay, Debbie. I need to start with consent. Do I have consent to record you, send it to my professor, and upload it to YouTube?
Yes.
Okay. So we're going to do your health history today. If you could give me your name and date of birth.
Okay. Debbie, October 18th,
Okay, can you tell me what gender you identify as?
female,
Okay. And what gender is on your birth certificate?
female.
Okay. Can you tell me what brought you in today?
Just an annual checkup.
Okay. When was your last annual checkup?
About a year ago.
Okay. Did they find anything at that time?
No.
Okay. Did you have any screening tests done? Mammograms?
Yes, I did have a mammogram.
Is everything okay?
Yeah, everything was fine.
Did you have a Hemoccult stool? Did they check your stool for blood?
I did the Cologuard.
Okay. Good. Do you know what the results of that were?
Everything was normal.
Okay, perfect. So can you tell me about any past medical history that you have? Have you had anything you're being treated for?
I take thyroid medicine,
Okay. Do you know how much you take?
60 milligrams.
Okay. And is it working?
I think so.
Okay. Are you experiencing any side effects from that medication?
I don't feel like I am.
Okay. Are you being treated for anything else?
No.
Okay. Have you had any procedures in the last year?
Procedures? No. Not in the last year.
Okay. Other than your thyroid medication, are you taking any other medications?
No, just a vitamin.
Okay. A multivitamin?
Yeah, just a women's multivitamin.
Okay. Do you have any allergies that you know of to medications?
No, I don't think I'm allergic to anything except seasonal springtime stuff.
Okay. Any food allergies?
No, no food.
Okay. Any allergies to animals?
No.
Okay. So, when was your last menstrual period?
I don't have periods anymore. I had tubal ligation and endometrial ablation about 15 years ago,
Okay.
give or take.
Okay. When was your last pap smear?
A year ago. That was my last checkup.
Was everything normal at that time?
Yeah, everything was normal.
And do you have a OBGYN that you see regularly?
Yes.
Okay. Family history? Do you know if anyone in your family has any cardiac history?
No.
Do you know if anyone has any gastrointestinal issues?
My sister has celiacs.
Okay. Do you know if anyone has any cancers?
No, no cancer.
Okay. Surgical histories. Have you had any surgeries in the past?
Tubal ligation, and then I had my appendix out when I was a child.
Okay. Any complications with either of those?
No.
Okay. While we're talking about your childhood, did you have any illnesses like chicken pox when you were a kid?
Yes, I did have chickenpox as a child, and I've had my titers drawn. I am immune.
Okay. Any complications?
Nope.
From any of that? Okay. So the ablation, no problems with that?
No.
Okay. Hospitalizations in the last year?
Only childbirth.
Okay. And when were your children born?
They were born in 1998 and 2000. They were both normal vaginal deliveries, no complications.
Okay. Any pregnancies that didn't go to term?
No.
Okay. Immunizations, have you had your flu shot this year?
Yes.
Okay. Have you had shingles shot?
No, I have not had a shingle shot, but I did have the COVID.
Okay. And do you remember what brand of COVID shot you got?
I got the Pfizer.
And how many did you get?
I had 3.
Okay. So let's talk a little bit about, you have the 2 children you said.
Mm-hmm.
Are you married?
Not currently.
Okay. Are you divorced?
Yes.
Okay. Do you use nicotine at all?
No. No tobacco products, no drugs, ever, and occasionally drink.
Okay. And how often would you say you drink?
I don't know. Just when I go out with friends.
Okay. And what type of alcohol are you usually drinking?
Um,
Is it liquor or wine, beer?
Probably mostly wine, maybe a beer every now and again.
Okay. Do you ever feel like you need to cut down at all?
No.
Okay. So as far as occupation, do you have a full-time job?
Yes.
Okay. Can you tell me what you do?
I'm a nurse.
Okay. And how many years have you been a nurse?
About 5, 4.
Okay. So, anything else you think I need to know about that?
No. Now that COVID's kind of not as risky, job seems perfectly safe now.
Okay. So, as far as diet and exercise go, do you exercise regularly?
Yes, twice a week at least.
Okay. And what kind of diet do you generally follow?
I am trying very hard to follow a Mediterranean diet.
Okay. And how long have you been doing that?
I have been doing that for close to a year now.
Okay. Have you ever had a bone density scan?
I have not.
Okay. Let's talk about your spiritual aspects. Do you have a church you affiliate with?
No, not really. I'm Christian, but I don't attend church.
Okay. Any community or other support groups that you're in?
I have a very supportive family.
Okay. Do you have any assistive devices that you use at home on a regular basis?
I obviously wear glasses. I have since I was a child. Contacts sometimes if I'm going swimming or something. No other assistive devices.
Okay. So these are just going to be some questions as I go through the different systems for you.
Okay.
Generally, has your weight changed up or down in the last year?
Yes, but it was purposeful and intentional. Watching my diet, exercising. I work with a personal trainer, so I've lost some of the weight I'm trying to lose.
Okay. Any weakness or fatigue?
Not that's concerning. It's much better since I started taking my thyroid medicine.
Okay. Any fevers that you're aware of?
No.
Okay. As far as skin goes, have you noticed any rashes, lumps,
No.
anything like that? Any sores,
No.
dry skin?
No.
Okay. Any changes in color or growths that you've noticed?
No.
Okay. And do you have any moles that you're aware of?
Yes, I have tons of them, but they're I keep an eye on them. No changes.
Okay. So, any headaches?
No.
Okay. Any injury to your head?
No.
Any dizziness or lightheadedness?
No.
And you wear glasses.
Mm-hmm.
When was your last vision appointment?
Maybe 6 months ago.
Okay. Any pain in your eyes?
No.
Any redness or excessive tearing?
No.
Blurred vision or spots?
No.
Any infection or discharge?
No.
Okay. How about your hearing? You feel like you hear everything around you? People aren't always asking you?
Well, well enough, I suppose. I mean, I think I did some damage going to concerts in my youth, but I obviously can hear normal voice tones.
Okay.
So,
So you don't have to ask people to repeat themselves very often.
not usually, but occasionally I do wish people would enunciate more.
Okay. Any condition with your teeth or gums?
No.
Okay. Are your teeth your natural teeth?
Yes, they're all mine.
Okay. So, do you see a dentist regularly?
Yes.
Okay. Any issues with your neck, swelling, pain, or increase in size anywhere that you're aware of? Okay. And you said you have had a mammogram.
Mm-hmm.
Any lumps or pain in your breast at all?
No.
Okay. Any discharge from your nipples?
No.
Okay. As far as your lungs go, have you had a cough for any length of time?
No.
Okay. Any sputum production or coughing up anything at all?
No.
Any shortness of breath or wheezing?
No.
Any pain when you're taking deep breaths?
No.
Okay. All right. So, have you ever been told you have anything cardiac related?
No, my last checkup, my blood pressure was normal and everything was normal. So, I mean, it was just the gynecologist, but he still said everything seemed fine. So,
Okay. So when you were a child, did you ever have rheumatic fever that you're aware of?
no,
Okay. Ever been told you had a murmur or an abnormal sound in your heart?
no,
Okay. Any feelings of racing heart or palpitations in your chest?
no,
Okay. Any trouble breathing at night when you're laying flat?
no,
All right. Any trouble with swelling in your hands or feet?
no,
Okay. Do you have any trouble swallowing?
no,
Any trouble with heartburn or appetite?
no,
Any nausea?
no,
Do you have regular bowel movements?
yes.
How often do you have a bowel movement?
Mostly daily.
Okay. And would you say that they're, brown, normal sized? They're
Yeah.
not watery or,
No,
okay. Any problems with constipation ever?
not really, no.
Okay. Any trouble with bleeding or tarry stools that you've noticed? Any hemorrhoids?
No.
Okay. Do you have any issues with gallbladder pain or pain in the right side that you're unaware of?
No,
Okay. So, as far as your legs go, do you ever have pain in your legs when you're walking? Do you ever feel like they're cramping?
no,
Okay. Any problem with varicose veins?
No.
Okay. Any problem with your hands or feet turning purple in the cold winter?
no, that
Tingling?
sounds dreadful.
Okay. Any trouble with urination?
No.
Do you feel like you wake up at night ever to go to the bathroom?
No, it's not an issue.
Okay. Any pain or burning when you urinate?
No.
Any blood ever in your urine?
No,
Okay. So we don't have periods anymore. We had the ablation. Are you experiencing any night sweats or anything like that?
no,
Okay. Any vaginal discharge?
No.
Itching or sores?
No.
Have you ever had an STI?
no,
All right. Any muscle pain or stiffness that you've noticed?
only after a hard workout, but it's supposed to be that way.
Any gout or pain in your toes at all?
No,
Okay. Any joint pain or swelling that you're aware of?
no,
Okay. Have you ever been treated for any psychiatric illnesses?
no,
Okay. Do you take anything for depression or sadness?
no,
Any plans to harm yourself or others?
no,
Okay. Any changes in your mood or attention overall?
no,
Okay. Any bruising that you've noticed?
nothing unusual, nothing out of the ordinary.
And any intolerance to hot or cold?
No, maybe a little before I started my thyroid pills, but not anymore.
Okay, good. Is there anything that I haven't covered that you think I need to know?
Don't think so.
Okay, well, thank you so much.